Thank you very much for having me here today as well. It's a pleasure to come speak at our event like this as well. As you said, I'd like to just follow on what you said. That the pandemic has brought up a lot of difficulties and a lot of unexpected challenges when it comes to working from home and within the offices as well. And we, as an organization, Lancashire BME Network, try to pride ourselves on being adaptive, whether that's to organizational needs, individual needs, or to the needs of the community as well. And what we found is that individuals working within our organization need that intensive one-to-one support throughout this pandemic. Initially, just like everyone else, we were all at home, and we felt that sort of disconnect between our team, and the regular meetings that we are having once a week as a catch-up just weren't cutting it. So what we implemented were one-to-one kind of scrums that we were having within our own kind of mini teams within the organization, and that went to some extent to sort of helping us out, because we all felt that huge disconnect, because we're in a really nice open plan office, but at home we were sort of really disconnected and sort of cut off from each other. And we pride ourselves on knowing everyone's work streams, etc. But at that point we were kind of focused on our own, and we didn't really know what everyone was up to. And at that point, speaking from personal experiences, the sort of workplace isolation at home starts kicking in. The blurred lines between your office and your home space started kicking in as well. And I'm sure a lot of you have felt that way over the course of the last 12 to 14 months too. But as things, slowly started to get better before they went worse again, we had a phased return back into the office for individuals, because a lot of individuals we found were feeling anxious about returning back to the workplace, for many reasons. But a lot of them had grown used to working at home as well, and that was due to many reasons. Could be familial issues, but mostly it was the anxiety of going out into the public and affecting their own families as well at the same time. And what we found is that when we did have the majority of staff back into the office from December onwards, we were doing socially distanced team scrums, and we were doing open door policies towards management as well, and that was something that was really important. And after team meetings, we were following up specific things within the minutes, or anything that was said privately within the chat as well. And what we found is that individuals were more likely to come towards us privately. The team meetings weren't exactly a specific place, so it's easy for an organization to say we catch up over Zoom regularly, and we check in with each other regularly. But it's that was one-to-one conversations that are really validating, and where we can find the bits and pieces about what's going on with the individual. We've got a dedicated wellbeing service that we're really proud of as well, which has got a counseling service and a befriending and bereavement service as well. So we've got a sort of holistic approach for the way we tackle issues within the community and within ourselves as well, and we try to apply that to our workforce too. But at the same time, it's been really challenging. I'm not going to sit here and sort of lie to you and say that it's been easy. We've still got our challenges. We've still got things that we're getting used to. We've changed a lot of things that in the way we practice our organization as well, and how we reach out to the community too. But at the same time, we're trying to be as adaptive as possible as well. But I think when we're following on to the breakout rooms, what I'd like to know, and what I'd like everyone to discuss, is what do you think your best practices are within your organizations, and what do you think could be improved upon as well? Because at the same time, no one was sort of ready for what was to come, but at the same time we had to all think on our feet as well. So yeah, I'd just like to pose that out to everyone as well. But thank you for having me.
Thank you, Warren, and thank you for inviting me as well. It's really nice to be here. I'm going to be talking about, sort of, rather than reflecting on how ACEVO has managed this, just going to be talking about a very short piece of research that we did last year. So I'm just going to share a few slides about that research, just to give you kind of introduction to it. Just start the slideshow. Can everyone see that okay? Good, I'm seeing some nods. So I work at ACEVO, which is the Association of Chief Executives of Voluntary Organisations, and we're a membership body for chief executives and senior leaders in the voluntary sector. And we were hearing from our members that they wanted to discuss and find a space in which they could discuss safely the well-being of their staff and how to manage that, how to make sure that they're creating a culture where staff can thrive and where they feel safe to bring themselves to work. So we launched a project in November 2019 in partnership with Mental Health First Aid England, where we convened a working group of 8 of our members to discuss how charity leaders can support greater workforce well-being. And it wasn't sort of formal or data-driven research, it was more just conversational. So lots of discussion and airing different ideas. And the picture sort of changed as we went through the project. So at first it was very much about workforce well-being, staff well-being, what leaders need to do with their power in those situations to make sure that people feel safe and happy at work. But also we ended up moving a bit wider than that and discussing the structures of the sector itself, the structures of leadership and the pressures that are sitting with CEOs and with boards, and how we might make changes to the structure of how organisations work to help people feel more well at work. So when we were talking about the need for this work, I think it's very interesting, this survey from Unite, that the union in 2019, that 42% of the people they surveyed working in charities felt that their job was not good for their mental health. So people are really feeling the pressure of working in the sector. And when in our pay and equality survey every year, we ask some questions about leaders' well-being. And 89% of the leaders we surveyed work extra unpaid hours every week. So people are really stretched. I know that's not the case just for leaders, but people are working a lot. And I think, unsurprisingly, we also know that people are experiencing bullying in charities and that there's some very toxic workplace cultures out there. And 87% of those people are saying that the impact is really severe on them, which isn't a surprise, but it does sort of demonstrate the bigger picture of what we're dealing with here. So from the conversations that the group had, there were a few key findings. The first sort of group was that there are specific challenges for people who work in charities and in the voluntary sector, social enterprises, which maybe other people in the private or public sector don't experience. So I think people often bring to a role in the sector real passion for a cause. They might bring lived experience. And if you're working on distressing and sometimes really challenging issues, that can feel very overwhelming. It can feel very personal for lots of people who do have that lived experience, and that brings new anxieties about your role and about what your work that you're doing every day. So I think the first thing that we needed to acknowledge was that there are specific challenges and specific vulnerabilities for people working in charities for their mental health. We also spoke about the impact on leaders of this. So they were talking about a real pressure to be authentic and to make sure that the people who work there can tell them when they need support, but balancing that pressure with business needs and with things that are often confidential and complex. So that pressure to be personable and to be open and to lead that good culture and really model good behaviour, but needing support themselves as leaders to do that. When we started the project, it was the end of 2019, so we had, I think, one meeting before lockdown, and the conversation really changed as part of as the pandemic took off. That real blurring of personal and professional boundaries was really difficult for people, and that feeling of not knowing what you can bring to work and what you don't bring to work anymore. People really spoke about that quite a lot. And another issue that came up at the time was the rise and a change in the sort of conversations about structural racism in charities and how people are managing those issues. And the fact that you had staff who have been, experiencing and dealing with racism for years and are only just feeling that they're being heard even slightly. So all of these external issues and the external environment changing really impact who people can be at work and the issues that they are having personally. And I think it really highlighted a need for leaders to make space within their working lives for those big external issues as well as what's going on internally. And then finally, we just spoke about governance and strategy and what that means if you're setting strategy at board level, how you can challenge structures that challenge that pressure that you might be putting on the CEO and on the staff team to deliver things, making sure that your strategy is sort of people centered rather than centered around growth or around huge amounts of income generation if that's going to put huge pressure on staff. So these were the sort of recommendations from the report, and one of the key things was boards can sort of ask themselves key questions to assess where they're up to. So, you know, do you have someone who's responsible for this? And have you agreed policies? Have you agreed what people can ask for and what they need? And I think though asking yourself those questions and getting boards where possible to start reflecting on this as an issue is a really important way of just bringing the issue higher up on people's agenda. So that's mostly it. I just wanted to sort of give a few discussion points, perhaps. Maybe when we were talking, we spoke a lot about making room for bigger conversations that often feel too big to approach. So, you know, do current government arrangements, the way that charities are run and the way that they're structured, exacerbate these problems? Is too much sitting with the leader, or is too much sitting with trustees? Is the delegation not happening effectively enough, and is that causing people problems? We spoke about a few ideas for practical resources, so if anyone has other ideas, it would be really interesting to hear them. But we spoke about a kind of sector-wide mental health and wellbeing charter, and also self-assessment tools, sort of similar to those questions, but something perhaps slightly more advanced. And I think also just it's really good to be at this event, because I think normalizing the kind of peer discussion and peer learning and sharing not only the good things, but sharing what's been really hard, I think is really important, because so much of this is about knowing that almost all organizations experience this, having really tired, really, challenging issues that their staff are dealing with. And no one is alone in trying to work out a way through that. And then finally, just how we can continue advancing anti-racism and anti-discrimination across the sector as part of this work. So what does it mean if we're talking about these issues in relation to people's mental health and well-being? How are those issues affecting or exacerbating existing problems? How do we have targeted approaches within a kind of wider highlighting of the issue? So I'm just going to stop sharing my screen and leave it there. Thank you.